Hi, come back to Nurse Nita again. Today we're gonna talking about the high yield topic that you always test on the NCLEX exam. If you want to pass the NCLEX exam, you need to know this topic. Okay, today we're gonna go for autonomic dysreflexia or AD. Autonomic dysreflexia is a condition in which the involuntary nervous systems overreact to the external or bodily stimuli. Autonomic dysreflexia is also known as autonomic hyperreflexia, which is a severe life-threatening condition that can occur secondary to the spinal cord injury. So this you need to remember is severe and life-threatening and is occur because of the spinal cord injuries as well. It can cause by the noxious stimuli such as full bladder, lie insertion, and fecal impaction. This treating is very important for the nurse that you need to assess and you need to know and you need to help the patient for this. You need to assess the bladder of the patient, is it full or not. You need to see that there is any fecal impactions or not. So because all these things can cause the autonomic dysreflexia as well, and this is the key role of the nurse that the NCLEX want you to know. This reaction can cause the autonomic dysreflexion can cause a dangerous spike in high blood pressure. It means the blood pressure is very, very high, is extreme high blood pressure. And it also can cause bradycardia, can cause the constriction of the peripheral blood vessel and other changes in your body's autonomic function. Autonomic dysreflexia is most commonly seen in the people with spinal cord injuries above the 6th thoracic vertebra or above T6. This is the key point that you need to remember. If the question on the NCLEX talking about the injury above T6, like T4, T5, can cause the AD, the autonomic dysreflexia. The patient may have the extreme hypertension and can cause many complications. So you need to think about the autonomic dysreflexia, okay? And it also can affect in the people who have multiple sclerosis, Guillain-Barré syndrome, head or brain injuries as well. So AD can also be a side effect of medication or drug use. AD is a severe condition. Say again, AD is a severe condition that is considered as a medical emergency. Why? Because it can cause extreme hypertension, and extreme hypertension can cause a lot of complications. What's the complication that can cause? This could be, it could be stroke, retinal hemorrhage, cardiac arrest, pulmonary edema. So where is the T6 and above T6? You can see in the spinal cord anatomy that I show on the pictures right here. Okay, so if the patient has the injury above T6, we should think about the autonomic dysreflexia. If the patient has the very high blood pressures, headache, and things like this. Okay, and then the symptoms of the AD may include the anxiety and apprehension, nasal congestion, severe hypertension, high blood pressure. The systolic blood pressure is over 200, and a pounding headache. The patient always complains about headache. Flushing of the skin, profuse sweating, particularly on the forehead, and dizziness, confusion, dilated pupils. Okay, this is the key symptoms of the autonomic dysreflexia. If the patient not get any treatment, the autonomic dysreflexia can cause the very, very harmful deadly complications like cerebral hemorrhage, pulmonary edema, and seizures. Okay. For the treatment, the key point of the treatment is try to reduce the blood pressure and try to remove the noxious stimuli. Okay. So how to try to remove the noxious stimuli? We need to assess and remove the full bladder, some line insertions, and fecal impactions. Okay. And the medication that we use in the severe hypertension to reduce the blood pressure quickly, hydralazine is the first line. Okay. The nursing interventions includes the nurse should first sit the patient up or elevate the head or bed. Why? Because we would like to reduce the blood pressure, reduce the blood that go to the brain. Okay. The patient had autonomic dysreflexia, they has a high blood pressure, has the headache. So if we sit the patient, elevated the head or bed, the patient will feel better about the headache, the bed will be better, and the blood pressure reduced. And the nurse should frequent vital check. What they mean vital checks is mean the vital signs, blood pressure, heart rate, respiratory rate, and the saturation gas, and also the neuroscience. So the nurse needs to check the neuroscience as well. Why? Because if there is any change in the neuroscience, that means that the patient might have stroke or seizure. That's the complication of the autonomic dysreflexia. Okay. And the nurse should loosen the distractive clothing, and this is a very important key point, assess for the full bladder or fecal impaction, because we want to remove the noxious stimuli that cause the autonomic dysreflexia. Okay, so this is the key points about autonomic dysreflexias. I make it for you for the one-page conclusion that all of the key points is here, and you need to try to make yourself understanding about the autonomic dysreflexia. Okay, and then we go for the example question. Okay, we go under question number 1. A client with a T4 spinal cord injury complains of a severe headache and has a BP of 210 over 110. The nurse observed flushed skin above the injury level. What is the priority nursing action? A. Administer acetaminophen for headache. B. Place a client in a supine position. C. Check for bladder in distension. D. Notify the provider immediately. I have the Thai translations on another side that you can read, but first I want you to try to read in English first, practice in English first, okay? So you read the question number 1 and you pick your choice, and then we'll see the answer later. Okay, question number 2. Which of the following are signs of autonomic dysreflexias? Select all that apply. Okay. A. Bradycardia. B. Severe hypertension. C. Pale, cool, lower extremity. D. Dry skin below the injury. E. Tachycardia. Okay, you pick your answer, and then we'll see the answers later. Okay, now we go to see the answer. For the question number 1, the keywords is T4 spinal cord injury, severe headache, BP of 210 over 110. So we think about the spinal cord injury above T6, patient had the severe headache, the extreme high blood pressure. So we think about the autonomic dysreflexia. Okay, So for the answer choice, we pick the correct answer is C. The priority is to identify and remove the trigger. Usually is a distended bladder or full bladder or fecal impaction. So for A, administer acetaminophen for the headache. So acetaminophen is cannot help for the AD because it's an extreme high blood pressure and patient has severe headache, so it cannot help. And place the patient, the client in the supine position, so it's not correct as well. So we need to place the patient in the not supine. We need to sit the patient or elevated the head of bed. Okay, so the C is correct. Is correct. The D, notify the provider immediately, is correct as well. But if we can check the bladder distensions first, that it could be help the patient identify the factors. Okay. Question number 2. The key point is signs of the autonomic dysreflexias and select all that apply. So the sign and symptoms of the autonomic dysreflexia is bradycardia, not tachycardia. Severe hypertension, yes. Pale, cool, lower extremity, yes, because of the vasoconstrictions. Okay. Okay, this is the key points of the autonomic dysreflexia that you always be tested on the NCLEX and example of the question and answer. I hope this could help you for the NCLEX to pass the NCLEX exam at your first attempt. Good luck. See you again next time. Bye.